Hello and welcome to the 4th edition of HealthTech For Patients, organised by HealthTech For Care and coming live from Paris. Wherever you are in Europe and around the world, thank you for joining us today at this unique event that puts patients at the heart of innovation and enables their voice to be heard. My name is Alison Munro and I'm delighted to be hosting our event. Today, we focus on the crucial realm of mental health, and in particular, we consider how illness and environment impact on our mental health. This afternoon, we have 2 round tables to bring us valuable insights and discussions with our panels of renowned European experts and key players from right across the healthcare innovation space. It is a great pleasure now to hand over, to introduce and open the event, to hand over to the chairman of the endowment fund HealthTech For Care and the CBO at Abivax, Pierre Courteille.
Thank you, Alison. So good morning, good afternoon, good evening, according where you are around the world. So it is my pleasure to welcome all the participants to the 4th edition of our HealthTech For Patients webinar. We are grateful to each of you for taking the time to join us today. First of all, we are excited to announce the recent launch of the European Patient Observatory of HTFP. So this initiative is dedicated to promoting and advocating for European policies that fosters medical innovation and ensure equitable access to healthcare for all European patients. So we encourage you to explore the first edition and share your valuable feedback and ideas with us, please. Our fund is committed to addressing critical but often overlooked issues such as mental health. Today's event is a platform for patients and therapists to engage in significant dialogues aimed at enhancing mental health care. So we look forward to the insight and developments that will emerge from these discussions to improve patient care. So thank you very much and enjoy the webinar.
Thank you very much, Pierre Courteille. And your voice counts. We are very keen to hear your feedback and to receive your questions. So please ask your questions in the question section on the platform. And these will be answered by our eminent speakers after the roundtable and after the discussions. Also, after each roundtable, we are very, very keen to get your feedback, to have your take. So please tell us what you're thinking, give us your feedback in the chat. And next week, after the event, of course, the replay will be available and up on YouTube. Now, we are also joined this afternoon by the board member of HealthTech For Care, Anaïs Le Corvec. Hello, nice to have you with us, Anaïs. And I know that she has some key insights that she wishes to share with us now at the start of our webinar. Anaïs, over to you.
Thank you very much. So thanks again for having me. HealthTech For Patients is a very important event. For us, I think it's great that this year it's on mental health, and maybe a little bit my role here is to explain why we chose this time mental health. First of all, for those who do not know yet, this is the European Mental Health Week, actually. So that is quite important. I just went through some key facts, real quick one. So just that's from the European Commission. So 46% of the EU citizens have had an emotional or psychological problem in the last 12 months. So that means 1 in 2. 89% of the EU citizens agree that mental health is very important. So that's almost all of us. And then 25% of EU citizens have had issues in accessing mental health specialists. So that's actually 1 out of 4, which is a lot. So we think, so how can, let's say, technology, because we're in HealthTech for Patients, HealthTech for Care, how can technology help us there? I think there are a few, let's say, few insights on what we can do better, and I hope in the roundtable today, this is a little bit what we're going to discuss, because mental health, if you have mental health issue, obviously it affects how you live, but also how you live affects your mental health, and this is the 2 roundtables, so looking at each side of it. So apart from the Mental Health Week, as I mentioned, I think the Commission is trying, for example, to work on 3 main lines, which are adequate and effective prevention. So prevention, I've asked some of my fellow colleagues on mental health, they're specialists and they all agree prevention is extremely important and would help, let's say, lower the impact of mental health issues. Access is essential, and it's true that the last years it's been, especially after COVID, it's been one key issue. And then one last point, which is maybe not talked enough about, is reintegration. So when one has a mental health issue or adverse event, could actually then get back into society. So those are, let's say, the 3 main lines of work. I'm not going to extend myself on all the EU policy. I know them a little bit, but not the expert. But what just why mental health is so important. So today I asked a question to, again, 2 of my fellow mental health specialists. If you had 3 million or 5 million euro, where would you invest them? And I prefer to give their words because they're the specialists. So obviously prevention came. But they also said, just to give a few examples of concrete cases, here in France, in concrete, they've seen an increase, a huge increase in adolescents, for example, going to a hospital for a mental health emergency. There's a really important increase. Also, we're talking a lot more about girls that actually go, and younger. So we're changing somehow when we talk about adolescents or children with mental health, this is something that will be talked about today. But those are facts. So is it because of COVID? Is it thanks to COVID that we're more aware of mental health? Do we talk more now about it, or do we talk because there's more issues? Obviously, big debates ongoing. But we think it actually maybe freed the way we speak about it, and we can talk more freely about mental health and more aware and less judgmental. Last but not least, maybe because I have the chance to moderate a roundtable later, so I can get deeper into it. But we do think that it's important to involve, as we've always said, in all the diseases, not in health issues. So co-creation, using technology as a mean to find solutions. And again, yes, access, I think, is absolutely key. And last but not least, we're in a program, so HealthTech for Patients, which is within the HealthTech for Care and the HealthTech for Innovation Days that I'm sure will be announced later. We're talking about technology. We're also in a technological world. So how does that affect our mental health? But how especially can we use those solutions to improve it? So this is a little bit my introduction on the key facts.
Wonderful. Thank you so much, Anaïs Le Corvec. Thank you very much. Pierre Courteille, thank you very much. We have, as you can see, we have some very interesting and important issues to be discussing and learning more about this afternoon. We are going to be taking now a very short break of 2 minutes before we dive into our first roundtable. Stay with us, and we'll be kicking off with the roundtable looking at how illness affects and impacts our mental health. See you straight away.